A very warm welcome to everyone. I'm delighted to have you all join us today for the third webinar of the Live Global Expertise webinar series organized by Pharmacy Wing of the Society of Clinical Research and Medical Professionals. I'm Kritika Singh and I'm honored to be your host for this insightful session. Today, we are diving into a critical topic, the role of pharmacists in controlling antibiotic resistance. Antibiotic resistance is a growing global threat, and pharmacists play a crucial role in mitigating its impact. This session aims to explore how pharmacists can contribute to responsible antibiotic use, patient education, and policy development to combat this pressing issue. Before we begin, there's a quick reminder for you all. So to please fill out the feedback form, which will be shared in the Zoom chat box during the session. Certificates of participations will be provided only to those who have completed the form. So before we dive in, I would like to tell you a little bit more about the SCRMP, the organization behind this event. Founded in 2024 and based in Telangana, India, the Society of Clinical Research and Medical Professionals is committed to empowering healthcare professionals and advancing clinical research through innovation, collaboration, and education. SCRMP supports the growth of life sciences and clinical research, driving impactful change on a global scale through key initiative, professional training, and knowledge sharing platform like the ones after today's webinar. Our motive is to promote clinical research as a recognized specialty amongst healthcare professionals, foster innovation and advancements in medical and pharmaceutical fields, facilitate international collaborations, drive excellence through partnerships, global opportunities, and cutting-edge research. Through workshops, seminars, and key other initiatives, SCRP is making a meaningful contribution to a global health and life sciences. We offer multiple membership options, each tailored to support the students, researchers, and professionals at different stages of our careers. The memberships provide with exclusive educational resources, networking opportunities, and accesses to events like today's lecture. Our membership, the lifetime members of the membership enjoy several benefits, including the general publications, opportunities to be a part of decision-making bodies, corporate exposure, leadership opportunities, networking and community engagement with industry experts, internship opportunities, and other national recognition with academic support. So if you are passionate about clinical research, pharmaceutical advancements, and professional development, SCRMP is the perfect platform for you. Now, without any further delay, moving on to the highlight of today's session, it's my great honor to introduce our distinguished speaker, Dr. Josep. Dr. Josep is an internationally renowned expert in pharmacy and medicine, currently serving as the director of the pharmacy and medicines area at the Consortium of Health and Social Care of Catalonia. He is also the Vice President for Europe Hospital Pharmacy section of the International Pharmaceutical Federation. He holds a PharmD from the University of Barcelona and has an extensive career spanning various roles, including hospital pharmacy, as a researcher, the visiting lecturer, the board member of the associations, adjunct lecturer in the clinical pharmacy and pharmacotherapy. His expertise in clinical pharmacy, pharmaceutical research, and hospital pharmacy has made a significant impact on the field and making him the perfect speaker to guide us through today's session. So it's my great pleasure to invite Dr. Josep to take the stage. So without further ado, I would like to pass on the stage to Dr. Josep. Dr. Josep, the stage is all yours.
Hello, good evening to everyone, and I would like to thank the Society of Clinical Research and Medical Professionals for your kind invitation to be today here with you and explain or even Mycobacterium tuberculosis. So we have different percentage of deaths that can be attributed to antimicrobial resistance. So it's a massive challenges, and pharmacists, we can play a role, but together with other healthcare professionals. So the high impact of antimicrobial resistance is not only that we need to use other antibiotics, is that many patients are dying because of antibiotic resistance or antimicrobial resistance. Which factors contribute to antibiotic resistance? Well, there are many factors. Maybe the first one is the inappropriate use of antibiotics, the overprescribing and misuse of antibiotics. Using antibiotics for viral infections is maybe one of the most identified point on inappropriate use of antibiotics. Self-medication, it means that there is an overuse of antibiotics without the advice of a medical or a healthcare professional. Some poor infection control practices, that inadequate infection control, measures in healthcare settings. The lack of awareness and education, it can mean that some healthcare professionals there can use maybe the wrong antibiotic or the wrong medicines for a patient, so creating this inappropriate use of antibiotics. There are also environmental factors, and in many countries we have identified that some antimicrobials are in the water. So that means that these antimicrobials that are in the water that can cause a spread of antimicrobial resistance, because these microorganisms can develop resistance because of the exposure to these antimicrobials. And globalization is another cause, because as you have seen that in different countries in the world there are different percentage of antimicrobial resistance, and patients and users and citizens, they can travel across the world and spreading some of these antimicrobial resistance. So maybe we can control in our country, but we have to be aware that some antimicrobial resistance will be coming from other countries, or we are spreading this antimicrobial resistance to other countries. Pharmacists, we have a unique position in the fight to antimicrobial resistance. These are the FAP, International Pharmaceutical Federation Development Goals. Is that there are kind of adaptation of the Sustainable Development Goals. And as you see, the number 17, that the International Pharmaceutical Federation said that antimicrobial stewardship was one of the goals of that pharmacies can develop to help in the development or in getting the goals of the Sustainable Development Goals of the United Nations. And in this goal, in this development goal, we can differentiate that our three different main positions as pharmacists, as the education and workforce element, to globally to develop strategies and systems to develop a pharmaceutical workforce prepared to deliver quality services for antimicrobial stewardship. So universities, pharmacy educators, we have a major role to prepare future pharmacists, to prepare or to develop continuous learning education to pharmacists to be prepared to deliver quality services for this antimicrobial resistance fight, and so to participate in antimicrobial stewardships. In terms of practice, pharmacists, we have to work and to develop or to guarantee that we have infrastructures and frameworks to deliver the services for antimicrobial stewardship. So in our place of work, to guarantee that we can lead or we can develop an antimicrobial stewardship. And as a scientist, also to help to promote research to develop new antimicrobials, new antimicrobial combinations, new techniques to evaluate the impact of antibiotic stewardship programs. So not only to develop these programs, also to evaluate and to improve their the practice, to guarantee that we can develop the more advanced practice and the major benefit to our patients and to our healthcare organizations. So pharmacies as antibiotic stewards, how we can develop or how can we work? To first of all, to coordinate the strategies, as we see that there are different factors that they can of antimicrobial resistant development. So pharmacists, we have to also coordinate different strategies to guarantee that each of these factors can be addressed because of the pharmacist, and maybe with other healthcare professionals, but pharmacists, we can play a major role. And the goal is to enhance patient outcomes, to decrease this number of deaths, to an excellent if they are they can serve as a benchmark for other areas, or the other areas they can look these excellent teams or excellent antimicrobial tips as a reference to copy or to learn of. The certification in the community, it's about different typologies. One is the organizational, that includes this benchmark to describe how the antibiotic stewardship is working, which is the structure. If it's enough multidisciplinary, so includes all the professionals that they have to be, and they have to participate to deliver proper excellence or proper aspects in the implementation. The institutionalization, it means that well, the commitment of the managers, the commitment of the executive teams of the institution is necessary to develop appropriate implementation of these antimicrobial stewardships. The human and scientific technical resources means that, well, apart from having the different professionals, these professionals or healthcare professionals, they have to have a practice or a knowledge about antibiotics, about antimicrobial resistance that is has a minimum standards to develop the proper functions of antibiotic stewardships. So not all the professionals serve. Sometimes we need healthcare professionals or scientific technical resources that are minimum. And for example, other resources can be also to have a microbiology team that is analyzing the resistance in our context.
So thank you so much, sir, for such an insightful session. Now we open the floor for Q&A session, and I would really ask the audience to ask the questions. And if you guys have any questions, please drop them in the chat box or raise your hand, and we'll make sure that they are addressed.
Good evening, sir. This is Bharadrav this side, sir. Basically, I have two questions regarding the topic. Sir, as we see in many healthcare systems or settings, pharmacists play advisory roles in ASPs but lack decision-making authorities. So, sir, should the pharmacist be given legal authority to either modify or reject inappropriate antibiotic prescriptions as a part of ASPs? This is my first question, sir.
Yeah, well, as I mentioned, the communication and having a role, a team role, it's crucial, not only for developing and other stewardships, is developing this that these stewardships or these teams, they have, we say that, good environment, a constructive environment.
I would like to extend my heartfelt thanks to Dr. Josep for his insightful presentation. Thank you so much, Dr. Josep, for your expertise and your experience. It was truly an enriching and enlightening webinar for us. Your contributions in today's session have been truly appreciated. I would also like to thank Mohammed Guiu Khan, our organizing secretary, for leading this initiative, and the entire SCRMP team for making this event possible. And of course, each and every one of you being such an amazing audience. This discussion has reinforced the critical role the pharmacists play in combating the antibiotic resistance. And I hope you all are leaving with valuable knowledge and actionable insights. So once again, don't forget to fill out the feedback form, which will be shared in the Zoom chat box right now, in order to receive your certificate, and then you can leave the session after that. So stay connected with SCRMP for such more impactful sessions, and we look forward to see you at our next webinar. So once again, thank you so much, Dr. Joseph and everyone. So have a great evening, and thank you all for joining us today.